After the age of 30, your body starts to produce fewer hormones. This is especially true for women who have gone through menopause. But this doesn't mean that everyone over 30 will start to experience hormonal changes. It all depends on your lifestyle choices. For example, if you eat junk food, drink alcohol, smoke, or have stress, it can speed up the production of hormones like insulin, cortisol, and estrogen. On the other hand, if you exercise regularly and maintain a healthy diet, you may not see significant hormonal changes until much later in life. However, if you are concerned about the state of your hormones, then I recommend getting a blood test to check hormone levels. What are the signs and symptoms? Here are a few signs and symptoms that can indicate whether or not your hormones have started to change after the age of change. Some people may experience only one or two of these symptoms, while others may experience many. And just because you have one or more of these symptoms doesn't mean that your hormones are out of balance. It could be something else entirely. So make sure to visit your doctor first before making any conclusions. Fatigue when you feel tired all the time, it could be a sign that your hormones are changing. Fatigue is one of the most common symptoms experienced by those with hormonal imbalance. It happens when there is too much or too little of certain hormones in the body. It is also important to note that fatigue is a symptom of many other conditions, so it is important to rule out other causes before diagnosing hormonal imbalance. Weight gain. If you've gained weight recently and you haven't changed your diet or exercise habits, it could be due to hormonal changes. Weight gain is a common problem for those who are experiencing hormonal imbalance. It can be caused by an increase in cortisol, insulin, or estrogen levels. Cortisol is a stress hormone that makes you gain weight around your belly. Insulin is a hormone that regulates blood sugar levels. High insulin levels can cause weight gain in the hips and thighs. Estrogen is a female sex hormone that can cause weight gain in the breasts, hips, and thighs. There are other hormones that can cause weight gain, but these are the most common. Anxiety and depression. Anxiety and depression are mental health disorders that can cause a lot of distress. They can also be caused by hormonal changes. A study published in the Journal of Clinical Psychiatry found that people with major depressive disorder had lower levels of serotonin than those without depression. Another study published in the British Journal of Psychiatry found that people with anxiety disorders had higher levels of cortisol than those without anxiety. Hair loss. Hair loss is a common problem for both men and women. It can be caused by genetics, age, stress, and hormonal changes. When you experience hormonal changes, your hair follicles can shrink, leading to thinner hair. This can happen when you have high levels of cortisol, testosterone, or estrogen. Cortisol is a stress hormone that can cause hair loss when it is present in high levels for long periods of time. Testosterone is a male sex hormone that can cause hair loss when it is present in high levels. Estrogen is a female sex hormone that can cause hair loss when it is present in low levels. Insomnia. Insomnia is a sleep disorder that can make it difficult to fall asleep and stay asleep. It can be caused by many factors, including stress, anxiety, and hormonal changes. A study published in the journal Sleep found that women who were going through menopause had higher levels of cortisol than those who were not going through menopause. The study also found that women who had higher levels of cortisol were more likely to have insomnia. PMS stands for premenstrual syndrome. It is a condition that occurs in women in the week or two before their period starts. Symptoms of PMS include breast tenderness, headaches, mood swings, and irritability. These symptoms are caused by hormonal changes that occur in the body during the menstrual cycle. Specifically, the drop in estrogen and progesterone levels triggers these symptoms. Erectile dysfunction. Erectile dysfunction is a condition that makes it difficult to get or maintain an erection firm enough for sexual intercourse. It can be caused by many factors, including physical and psychological problems. In men, erectile dysfunction is often caused by hormonal changes. A study published in the International Journal of Impotence Research found that men with erectile dysfunction had lower levels of testosterone than men without erectile dysfunction. Low libido, a low sex drive, is common, but it can become a problem if it causes distress or affects your relationships. Low libido can be caused by many factors, including stress, anxiety, and hormonal changes. In both men and women, low libido is often caused by low levels of testosterone. Testosterone is a sex hormone that plays a role in the desire for sex. Low levels of testosterone can lead to a decrease in libido. Skin problems? Skin problems such as acne, dryness, and irritation can be caused by hormonal changes. Hormones regulate the amount of oil produced by your skin. When your hormones change, your skin may produce more or less oil than usual. This can lead to different types of skin problems. For example, acne is a skin condition that occurs when there is an excess of oil on the skin. Dryness and irritation can also occur when there are changes in hormone levels. Breast tenderness. Breast tenderness is a common symptom of PMS. It can also be caused by hormonal changes that occur during pregnancy, menopause, and breastfeeding. When your hormones change, the tissues in your breasts can become swollen and tender. This can be painful and uncomfortable. Menstrual cycle changes. The menstrual cycle is controlled by hormones. When your hormones change, your menstrual cycle may also change. This can include changes in the length of your cycle, the amount of bleeding, and the frequency of your periods. For example, if you have irregular periods, it could be a sign that your hormones are changing. Digestive issues such as constipation, diarrhea, and bloating can be caused by hormonal changes. Hormones control the function of your digestive system. When your hormones change, your digestive system may not work properly. This can lead to different types of digestive problems. For example, constipation is a condition in which you have difficulty having bowel movements. Diarrhea is a condition in which you have loose and watery stools. Bloating is a condition in which your abdomen is swollen with gas and fluid. How to diagnose hormonal imbalance. If you are experiencing any of the symptoms I mentioned earlier, it is important to see your doctor. Your doctor will ask you about your symptoms and perform a physical exam. They may also order some blood tests to check your hormone levels. How to treat hormonal imbalance? The treatment for hormonal imbalance will depend on the underlying cause. If you are overweight, losing some weight may help balance your hormones. If you are stressed, getting help to manage your stress may be beneficial. In some cases, hormone replacement therapy may be an option. This involves taking hormones to replace those that are deficient. Can you prevent hormonal imbalance? There is no sure way to prevent hormonal imbalance, but making healthy lifestyle choices can help. These include eating a balanced diet, exercising regularly, managing stress, and getting enough sleep. In conclusion, it is normal to experience some hormonal changes after the age of 30. However, if you are experiencing any of the symptoms I mentioned earlier, it is important to see your doctor. With proper treatment, you can balance your hormones and improve your quality of life. Do you know anyone who has experienced hormonal changes after the age of 30? Share your thoughts below. Also, don't forget to subscribe for more informative videos like this one. Thanks for watching. See you next time. Disclaimer: this video is for educational purposes only. It should not be used as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or treatment before making any decisions.